second opinion. Most insurances, Medicare, Medicaid accepted. We're super convenient, Broadway and 38th in Manhattan. Hyperthermia 2. To hit your cancer, call 212-CHOICES. 212-CHOICES for Radiosurgery, New York. For prostate cancer treatment, results and quality of life matter. Hi, I'm Dr. Gil Lederman from Radiosurgery, New York. Our enviable record includes treating thousands with prostate cancer. Critical to every man with prostate cancer and their loved ones is quality of life, urinary and sexual, and great treatment data while avoiding surgery. Treatment here is outpatient, with most insurances, Medicare, Medicaid accepted. First in America with radiosurgery. For cancers from head to toe, we have the expertise to hit the cancer. Our fresh second opinion could change your life. For prostate cancer treatment, call 212-CHOICES. 212-CHOICES. Radiosurgery, New York. Super conveniently located in Manhattan at 38th and Broadway, hits the prostate cancer. Call 212-CHOICES. 212-CHOICES to hit the prostate cancer.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hey, we're back. I'm Dr. Gil Lederman, talking about cancer treatment and current data, which we just talked about ways of saving people's lives.
Yeah, it's a good deal.
Right, and if you have 200,000 women with breast cancer and you can save 10%, that's 20,000 lives.
It's a lot.
It's a lot. 20,000 people. 20,000 people. Just in one study, us talking on the radio, we're hoping that people listen and do the right thing, and we hope your friend does the right thing because maybe she can save her life too.
Hopefully so.
Hopefully too. I bet you were emailing her that article. I bet you were. We've got a call. Let's see if we can listen to it on the radio. Good morning. It's Dr. Lederman. You're on radio with 50,000 listeners. Good morning. Good morning.
Yes, I was calling to get the information.
Yeah, just call us after the radio show. You're on the radio show now, so you have to call us after the radio show, and we'll be happy to send you a free booklet and DVD, okay?
Thank you, sir.
Thank you. God bless you. Bye-bye now. So just call us after the show or during the week. We'll send you a booklet and DVD about our data, and hopefully you can learn new choices and ways to save your life. Now, recently we spoke to a chief of a hospital department, and he said, why advertise? Dr. Lederman, why do you advertise? And I said, well, we're not part of a hospital where patients get pinged around. The surgeon sends it to the chemo sends it to the surgeon. The
surgeon sends it back to chemo.
Yeah, the radiologist sends it back to the chemo, the surgeon. Patients just go in circles. And sometimes it seems a little bit like a conspiracy. And you'll see here, we've got a couple cases where these patients are getting pinged around a hospital, and they're not necessarily getting all the choices they want. A patient should have a fresh second opinion and get choices. For example, this gentleman came in. This gentleman's about 55 years old. Came in with his girlfriend and his daughter, and great man. He's a crane operator, very strong, very handsome. He had rectal bleeding. So he had blood from the rectum for 3 years.
That's a long time.
It's a long time. Now, his doctor told him, it's just hemorrhoids. Now, hemorrhoids is a diagnosis, right?
Yeah, it's a real thing.
What are hemorrhoids?
You can explain it better.
Well, it's abnormal blood vessels near the rectum that can bleed. But not all rectal bleeding is hemorrhoids, okay? You have to look inside and see what the diagnosis is. You can't assume something. And we had a case like this last week. This is not the same case. This man waited 3 years, had rectal bleeding, told his doctor repeatedly, not one time, not 2 times, not 3 times, repeatedly, 3 years. And finally, 3 years later, the stools were getting narrower, meaning the bowel movements were getting smaller and smaller.
Something was obstructing the colon?
Why would the bowel movement get smaller?
Something's obstructing it.
Yeah, there's a grasping. Something's closing off the rectum.
It's like a pipe, and you're closing off the pipe.
It's like a pipe closing off. Okay, so not only is he having bleeding, but the stools are getting narrower and narrower. Okay, 2 bad warning signs, right?
Very bad.
Okay, he had 1 sign, was missed. He went to the doctor repeatedly, missed, bad. Now the stools are getting narrower. Now more time passes. Finally, he sent for colonoscopy. Finally, years
After 3
later.
years.
And the colonoscopist couldn't even get a scope inside because the cancer was so obstructing the rectum.
Wow.
Okay? Get a second opinion. That's why we say get a fresh second opinion. You're having problems. You're not getting answers. Give us a call. 212-CHOICES. Call us. I mean, the 3-year wait with rectal bleeding and stools narrowing. Wow. He finally goes to surgery, and what happens? The cancer was diagnosed, yeah, but it already spread to the liver. So instead of being a localized cancer, it was already a stage 4 cancer.
Because it metastasized by then.
It metastasized. In all those years that he was saying, Doc, I got rectal bleeding, it spread. Wow.
So do something early.
Get out of the ping, ping, ping system, okay? Ping, ping, ping. We have the good old boys network. Everyone sends the patient to each other. Everyone extracts their you-know-what, and wow. Get out of the system. Get a fresh second opinion. Get a fresh second of eyes. You don't have hemorrhoids if you've got rectal bleeding necessarily. You might, but you might not. And you want to be misdiagnosed, delayed diagnosed? I don't think so. I think that you're listening because you want to get better care. Okay, so eventually, and this all started in 2003, so this is not new news. It started in 2003. It's new news to us because he just came to us, and he came to us because he heard about us on the radio. So in 2006, he finally had the surgery. The cancer spread to the liver. The surgeon tried to biopsy some of the liver metastasis, remove part of the rectal cancer.
Big surgeries.
He had chemo. Then the cancer came back. He had more chemo. He's tired of chemo. Then the cancer came back again with a mass in his abdomen, one solitary mass, one mass. He was opened up, did major surgery. So you know what it is to do a laparotomy? What does a laparotomy mean?
You're basically going to open up the abdomen and try to take something out.
Right. Well, laparotomy means just opening up the abdomen, and then the resection is to take out something, right?
Yes.
So he had a laparotomy and a resection, and they took out some of the cancer, and then he had more chemo, and that was last year, and now the cancer's come back in one spot.
It's a combination of chemo and it's a lot of chemo and operations he's having.
And he's fed up with it. He is so tired of it. He doesn't want it anymore, okay? And maybe sometimes when they do the surgery, instead of removing the cancer, it actually spreads the cancer. Have you heard about that?
It's like crumbs.
It's like slicing a loaf of bread without any crumbs. So the surgeon sometimes slices the loaf, but the cancer comes back, and we're going to talk about a case in a minute. Same thing. So now he's got one mass by his psoas muscle. The psoas muscle is
a muscle in the lower...
It's in the back, in the pelvis, right. Now, psoas, how do you spell psoas?
P-S-O-A-S.
P-S-O-A-S. Now, why is there a P there?
I don't know.
Well, the P is silent, right?
Yeah.
Now, when I was a kid, we used to say, the P is silent, like in swimming. So it's psoas muscle. So he's got a mass in the psoas muscle. He was diagnosed 2 months ago. He doesn't want to have chemo. He doesn't want to have surgery. He wants radiosurgery. So he's really smart. Okay, he wants treatment that is highly effective, correct?
But
that is non-invasive, no cutting, no bleeding, no hospital stay, no IVs. You come in, get a treatment, and you go out shopping or to the movies or to lunch or go back to work and live your life. A treatment's 15 minutes. So we were the first ones to perform stereotactic, non-invasive, body radiosurgery in the Western Hemisphere, in America, in New York, even in our office. We were the first ones. The first ones. Why? Because we believe that there are better options. You don't have to have cutting. You don't have to have bleeding in every case. Sure, there are cases where we'll recommend that if that's the only and best option, but maybe that should be the last option, not the first option. So this man came in our office. He's getting staged. We got all the approvals for him. I said we take most insurances, Medicare, Medicaid. We got all the approvals. He's going to come in one day. He's going to get the new PET scan. We're going to see exactly where the cancer is. And then he's going to come over to us. He's coming on Tuesday. And then we do a fitting of his body. We make a stereotactic frame. There's no cutting, no bleeding. We scan him. We computerize where the cancer is three-dimensionally, correct?
Yes, we do.
And we send in beams to hit the cancer.
From different angles.
From many different angles. They hit the cancer, don't harm the tissues. In a tumor his size, we wouldn't anticipate any side effects. Our success rate is very high. It's about 90% for the rest of his life where we aim the beam. And he can avoid that surgery. And that surgery, look, he had surgery. He's had surgery at diagnosis on the rectum. He had surgery on the liver. He had surgery at metastasis. And the cancer's back. So the beauty of our treatment is there's no surgery. We don't spread the cancer. There's no cutting, but we don't spread the cancer. We don't touch the cancer. We can treat it and kill it, most likely, without harming the patient. That's the goal here. Treat the cancer, don't harm the patient, and let him live his life. He's a crane operator. He's a beautiful girlfriend, great daughter, great family, great man. Let's keep him going. Let's keep him alive and healthy.
Sounds like a good plan to me.
If you have rectal bleeding, what do?
Don't wait.
Don't wait. If your doctor thinks it's hemorrhoids, you got the wrong guy. You got the wrong woman. It could be any sex, but you got the wrong answer. You got to be diagnosed. You got to be diagnosed.
You need a physical exam.
You need a physical. You need to find out exactly where it is. Now, I'm from Iowa. Now, in Iowa, when we have railroad tracks all over the place. There's not so many railroad tracks in Manhattan. But in Iowa, when you go to a railroad tracks, there's a sign, a crossbars on the railroad tracks. You know that? It says railroad tracks.
Don't stop on tracks.
And you know what else it says? It says the number of tracks. Because sometimes the train leaves, you're standing there, toot, 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 toot. The train goes by, and you put your car into gear, and you go across, right?
Yeah.
But what if there's a second train? What if there's a second train? So on the crossbars of the railroad stopping, it says 1 track, 2 track, 3 track. So just because one train's gone doesn't mean that there's another train coming to hit you from the other side.
Hopefully not.
Right? So just because, even if you do have hemorrhoids, it doesn't mean the hemorrhoids are bleeding. So you can have two things going on.
You could have hemorrhoids and cancer.
You could have hemorrhoids and cancer. So just like the railroad tracks, look out and see. Make sure there's not 2 tracks and 1 track, because you're going to get slammed by the second train. You're not going to be any happier. So get the proper diagnosis. The proper diagnosis may not always make you happy, but at least you know what you're dealing with, and then you can take action and do the right thing. So again, we're at the ABC studios. We're live, 800-848-9222, 800-848-9222. We're going to go to a word from our sponsor, and we'll be back with more cases and more information to make your life better. Here's a word from our sponsor, the man with the platinum voice.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within 1 business day, because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hey, we're back. Good morning, Ariel. We're back.
Yeah, here we are.
We're live.
Yes, we are.
Let's stay that way, and you all should stay live, too. We like you better that way. We like our listeners. We love our listeners. Hey, there's a great article about prostate cancer, still a leading cause of cancer deaths. Wow.
Everyone's out there talking about no one dies from prostate cancer, but the facts are just the opposite.
How is that so?
How is it so? How is it so? Yeah, the risk of dying from cancer has declined